What is psychosis? Psychosis is a mental illness that changes how information is processed in the brain. You lose contact with reality as a result of it. It's possible that you'll see, hear, or believe things that aren't true. Psychosis is a symptom, not a medical condition. A mental disease, a physical injury or sickness, substance misuse, or excessive stress or trauma can all provoke it. Psychotic illnesses, such as schizophrenia, cause psychosis to appear for the first time in late adolescence or early adulthood. Young individuals are more prone to contract it, but it isn't understood why. You may display subtle changes in the way you act or think before what physicians term the first episode of psychosis. Even if you don't have a major psychotic condition like schizophrenia or bipolar disorder, you might lose contact with reality. This is referred to as secondary psychosis. These occurrences are the result of something else, such as drug usage or a medical issue. Whatever the source, they usually go away quickly and they frequently remain away if the underlying disease is treated. Symptoms of psychosis. There are several warning signs to look out for which gradually lead up to a psychotic episode. Some things to look out for could include feeling no emotions at all, spending more time alone than usual, stronger emotions to trivial things, lack of self-care or poor hygiene, feeling suspicious and uneasy around others, difficult to think clearly, poor concentration, drop in job or educational performance. Some symptoms that occur during a psychotic episode are hallucinations, which can come under three categories: auditory hallucinations, hearing voices or sounds, tactile hallucinations, strange sensations or feelings that can't be explained, visual hallucinations, seeing people or things that aren't there. Delusions are another symptom of a psychotic episode, which could include such things as believing you have superpowers, believing you are on some sort of mission, or even believing that you are actually God. You may believe that outside forces are in control of your feelings, thoughts and actions, and you may believe that insignificant events or comments have huge meaning. Causes of psychosis. Although it isn't known exactly what causes psychosis, some causes of psychosis are believed to include genetics. Could be in your genes and may have a family history of psychotic episodes. This is not a guarantee that someone will suffer psychosis. Drug abuse. Both depressant drugs, such as cannabis, and stimulant drugs, such as cocaine and amphetamines, can dramatically alter your brain activity, causing what you believe to be true to be false. When you stop using these drugs, this usually goes away. All of these medicines, however, have a substantial relationship to primary psychosis. More than a quarter of those diagnosed with amphetamine-induced psychosis develop psychotic problems later in life. In nearly half of all instances, cannabis is implicated. Trauma. Suffering some kind of trauma could trigger a psychotic episode. This could be going through a divorce, being a victim of an assault, or the loss of a loved one. Medical treatment for psychosis. It's critical to get treatment as soon as possible following the first episode of psychosis. This can help you avoid having your symptoms impair your relationships, employment, or education. It may also assist you in avoiding future issues. Doctor recommendations will depend on the cause of psychosis. To relieve symptoms, doctors will usually prescribe antipsychotic medicines in the form of tablets, liquids, or injections. They'll also advise to stay away from drugs and alcohol. It is estimated that 3 out of 100 people will suffer from psychosis in their lifetime, and roughly 100,000 adolescents suffer their first episode of psychosis every year. Luckily, there are many treatment options available, and for many people a psychotic episode is a one-time occurrence. Please give this video a like and consider subscribing to the channel. Thank you for watching.